The eastern state of Thuringia is loosening the restrictions. Social distancing will not be enforced next month because the Premier says there's no longer any justification for infringing people's rights. 239 known cases of infection are not a legal basis on which to say to more than 2 million residents, we will be knocking on your door and asking whether there are too many people drinking coffee together in your house. But the Premier of Bavaria is warning against making dangerous assumptions. Anyone who thinks corona is over is being naive. Since we don't know exactly how the science is going to develop, the sensible course of action remains the same, staying calm and prudent and acting on a step-by-step basis. That caution gets a mixed response in Potsdam, but polls show 3/4 of Germans agree with the measured approach being taken by Bavaria and in Berlin.
Well, still to come, Nightlife on life support. We'll take a look at efforts to put the party into post-pandemic clubs and bars.
It's quite reviving being out again and seeing your friends and kind of feeling like it's getting back to normal.
Well, it is one of the biggest and perhaps most tragic ironies of this pandemic. The lockdowns and restrictions taken to protect people from the virus have made it easier for adults to hurt our kids. The children's aid organization World Vision says the pandemic has led to a surge in violence against children, as well as forced labor and underage marriage.
Schools out in Ivory Coast. This was March. Since then, hundreds of millions of boys and girls around the world have been in lockdown. No classrooms, no playgrounds, and nowhere to run. Now, charities are warning that the very measures meant to protect them could see them fall victim to violence. Like 12-year-old Kabita in Bangladesh, whose father is out of work.
Dad hits us if we ask for more food. He's frustrated and angry. It's hard to concentrate because I'm hungry. I have headaches and sometimes feel dizzy. Everything around me seems blurry.
Across Bangladesh, World Vision has been helping children whose family lives have been turned upside down by this virus. But these are unprecedented times.
This crisis is like nothing we've seen before, definitely. It exacerbated risks that were already there in most of the cases. For example, the child protection services or the protection that was provided by school are now being totally wiped out.
World Vision estimates that 85 million more children may be exposed to violence during quarantine. In Bangladesh, beatings by parents increased by 40%. An additional 4 million girls are at risk of being forced into marriages in the next 2 years. The UN says that spike is the result of families looking to recover financial losses. Frontline workers are concerned that failure to act now will lead to more trauma in the future.
I remember as a social worker having a case where 2 of the 7 brothers in an abusive family actually developed schizophrenia very early in their age as a result of the domestic violence and violence against themselves.
For months, the coronavirus crisis has been one of ambulances and intensive care wards. Now, experts say without extra funding and protection, it may give way to a crisis that is longer lasting and harder to heal.
Well, my next guest sounded the alarm 3 months ago connecting children abuse and COVID-19. Cornelius Williams is Associate Director of Child Protection at UNICEF. He joins me tonight from New York. Cornelius, it's good to have you on the day. It was March 20th when you sent out the press release warning the world about the dangers of the pandemic for children in these lockdowns. Were your warnings heeded?
Well, some governments did heed the warning. Some charity did respond. But by and large, we haven't seen actually the response, I think, has not been adequate in providing the kind of protection and support the millions of children need. Actually, the 77% of children under 18 who are living in countries where there's a stay-at-home policy or lockdown, we don't think the response has been adequate.
And why do you think that is so?
Virtually, actually, the world has to prioritize, actually. The world has to prioritize child protection. One of the first things, actually, we had asked for is that the social workers and these child protection workers should be made essential workers, that we should try in all means to make sure that these child protection workers have contact with children who were affected, right, by this already suffering from violence in the homes they were living in, who were disabled, right, who would need services. So when the lockdown happened, okay, those who were in contact with children, who were providing services to them, are now being cut off, and we're scrambling and trying to use all kinds of virtual means to get to those children. But the most important thing is to make sure that actually the workers are prioritized for these cases.
You know, you talk about priorities from China to the U.S. to right here in Europe. You know, there's this constant drumbeat about restarting the economy. There's not a drumbeat about protecting the children. What has this pandemic revealed to you about the value that we all place on our children?
You know, actually, there's somebody who said the children are going to pay the price, right? Are the children going to pay the price, actually, for restarting the economy? Are the children going to pay the price for the strategies that have been put in place? If we value children who are the next generation, who are the ones who are going to be able to do the rebuilding? Who are the ones who are going to take the world forward after the COVID experience is gone, right? Then we should make sure that all policies that are developed respond to the needs of those children. The policies have to ensure that the children are protected during the containment phase and after the containment phase, that we build back better protection systems for those children. The policies have to make sure that the loss in gains in education that the children have suffered from is built into the policy. We should have that as part of the drumbeat, right? We should have also the loss in gain in health care, the vaccinations that needs to be done, the child care that needs to be done. So no matter what kind of economic policy you put in place, economic policies are made up of human beings, actually, and you would need these children as your citizens in your country to take forward this economic policy.
We've got about 30 seconds, Cornelius. Let me ask you, is there anything, though, in this crisis with children that has pleasantly surprised you?
First of all, we've been pleasantly surprised at the resilience of children. Remember what has happened to the world. Billions of children were one day taken from where they physically play, laugh, and learn to a virtual world. And these children have shown incredible resilience in responding actually to this shift in their life. And so we should recognize the children and their resilience. We should recognize their ingenuity, actually, and how they have responded to this COVID experience and the lockdown.
Okay, Cornelius Williams, Associate Director of Child Protection at UNICEF. Cornelius, we appreciate your time and your insights tonight. Thank you.
Thank you very much for having me.
Well, chances are you have not been clubbing or out to a bar in a long time, unless you live in Iceland. That small island country in the North Atlantic has been a world leader in testing for COVID-19, and the government says it now has the pandemic under control. So after a 9-week hiatus, bars and nightclubs are open again.
Monday night in Reykjavik. For the first time in more than 2 months, people could meet their friends out for a drink. And some were even ready to show off their moves on the dance floor again.
It's quite reviving being out again and seeing your friends and kind of feeling like it's getting back to normal. We're definitely getting rid of this virus. Everything's going so well and we're heading for such a good direction. We want to keep it that way.
Mass testing and early tracing are being cited as the main reasons for Iceland's relatively low rate of infection, and only 10 people have died from COVID-19 in the country. But as Iceland's bars are allowed to reopen, authorities will be keeping an eye on the situation. Earlier this month, South Korea had a spike in infections after nightclubs were reopened there. For bar owners, the easing of restrictions is a blessing. It's just like being born again. It's been a hard period, but I think we'll come out of this strong. At least I hope so. While the bar is finally open, those who were hoping to avoid Iceland's bright nights and dance until the early hours under disco lights might be disappointed. 11 p.m. is closing time for now.
All right, and fresh from the clubs is my colleague here, Joel Delroy. He's been reporting on this story. So, Joel, how safe is it? Is it safe to go out to the clubs in Iceland now?
Well, health experts are saying that we shouldn't be opening nightclubs until there's a vaccine or until there's a sufficient level of immunity in any given population. And nightclubs are, of course, ideal places for transmission for an airborne virus. They're closed quarters, people are speaking in very close proximity. So it's a bit of a risk, but every day we're hearing of more countries easing their lockdown measures and allowing people to return to drinking establishments. The Czech Republic has reopened its famous breweries. Hong Kong says its nightclubs and its karaoke lounges will reopen within a few days. They're taking a risk. We know that in South Korea, there was an outbreak in a nightclub district just a few weeks ago. More than 200 people were infected. That led to more than 60,000 people having to be traced and tested. So countries that are doing this, they're taking a gamble that they now have the resources and knowledge to be able to deal with the consequences that they didn't have before.
I can imagine that a lot of people here in Berlin are watching what happens in Iceland. Berlin is known for being a city of clubbing. Are the clubs here in Berlin, are they likely to reopen anytime soon?
Well, the short answer is no. Berlin city government is being very cautious, more so even than other German states. It has allowed restaurants and cafes to reopen, but there's nothing on the horizon for clubs and nightclubs. And Berlin has good reason to be cautious. One of the first clusters of coronavirus outbreaks in this city was in a nightclub. Of course, that has left the operators of nightclubs in a very difficult position. Many of them are worried about how they're going to survive. Right now, they are earning donations from live-streamed DJ sets, but that isn't enough to cover the rent in the long term. And they're currently proposing creative solutions to allow them to open. For example, holding outdoor events in public parks, having all their guests wearing masks and using apps to trace people. Now, one by one, industries are pleading their case for their right to be able to reopen and proposing solutions. For example, today, the German sex workers industry proposed that legal brothels be allowed to reopen as long as the clients are wearing, the sex workers are wearing masks. Now, just as with nightclubs, there's no indication that these proposals are being taken seriously.
Yeah, we have to remind our viewers, too, that prostitution is legal in Germany. We understand that there is an American company that has come up with a vision of safe clubbing. What is that?
I'm not sure if you're going to like this very much, Brent. I don't know if anyone's going to like it, to be honest. But the company has come up with an idea called a microshell, and they say it is a socially responsible solution to allow people to interact in close proximity. Let's have a look at what they're talking about. It is basically a bodysuit, looking like some kind of spacesuit. It comes with nozzles inside the masks there that you can drink out of and vape out of at the same time, they say. It's only covering the top half of your body, so the bottom half is free for other bodily functions. Basically, the only practically interesting thing about this that I think I would actually want is that there's a volume control inside the helmet so that you can turn down the music if it gets too loud. And, you know, to me, that sounds like a pretty good idea. I've been in some noisy nightclubs before.
It looks like techno from the 90s, though, doesn't it? A little bit.
It's a little bit out of style. And, you know, that's another one of the problems. So far, the company seems to have only proposed one colour. And the last thing you want is to show up at a nightclub and realise that someone else is wearing the exact same antiviral protective suit as you.
That would be very uncool, that is for sure. Joel, as always, we appreciate your reporting. Thank you. The day is almost done. The conversation continues online. Join us on Twitter at DW News. You can follow me at Brent Goff TV. And remember, whatever happens between now and then, tomorrow is another day. We'll see you then, everybody.
You're watching Northern California Public Media, made possible by viewers like you.
Please join us tonight at 7 for our Coronavirus Virtual Town Hall, What You Need to Know. Send your questions for top county leaders to viewer@norcalpublicmedia.org or find us on social media. We'll be live on KRCB TV 22, KPJK TV, and on KRCB FM Radio 91. See you tonight at 7.
Hi, I'm Darren Lachelle, President and CEO of Northern California Public Media. During these challenging times for all of us, I want to remind you that NorCal Public Media is your trusted source for information in the Bay Area. NorCal has always been your home for education, and we're providing educators and caregivers with more resources to help with distance learning for students. Weekdays between 6:30 a.m. and 9:30 a.m. and from 1 p.m. to 4:30 p.m. we have programs that focus on literature, social studies, science, and more, all tied to California state standards. Saturday learning is also available between 7 a.m. and 10 a.m. Find lesson plans and thousands of digital resources online at norcalpublicmedia.org/education. Together, our community will get through this, and NorCal Public Media will continue to be here for you.
I want to remind folks that staying home is the only way to stop the coronavirus. We need to continue to take this seriously. We're in unprecedented times, and I'm really proud of how our community and our organization has stepped up to take care of one another. Let's continue to look out for our loved ones by staying home and only going outside for food or health reasons or essential work.
Si sales, mantente a 6 pies distante de otras personas.
Cuando llegue a casa, lávese sus manos por 20 segundos.
待在家中是防止新型冠状病毒的唯一方法。
Nếu mà phải tiếp xúc với nhau thì phải cách nhau ít nhất là 2 mét. Rửa tay thì phải thường xuyên trong ngày, mỗi lần là 20 giây với xà phòng.
Thank you for doing your part to stop the spread of the coronavirus and protect all of our vulnerable.
Welcome to Coronavirus What You Need to Know. This is our 12th live town hall program in the series. These live interactive special events are produced with input from public health agencies around the Bay Area and many nonprofit organizations working on COVID-19 related challenges. Good evening, I'm Darren Lachelle, President and CEO of Northern California Public Media.
And I'm Adia White, Assistant News Director at Northern California Public Media and your co-host for tonight's show. Governor Gavin Newsom announced new guidelines for allowing religious services and in-store shopping. We'll talk with Sonoma County Health Officer Dr. Sindri Mace about how this will affect our community. We'll also talk with a representative from the organization Health Professionals for Equality and Community Empowerment about what healthcare workers are seeing on the front lines of the pandemic. We'll also learn about resources available for those in need. Darren Lachelle has more on how to submit questions for tonight and next week's Town Hall. Darren?
These town hall programs give you the opportunity to ask public health officials, medical professionals, and our elected leaders the questions that are on your mind. Submit your questions through the contact form on our website, norcalpublicmedia.org/coronavirus. Now, next Tuesday night, June 2nd, is our last live town hall program. Use the contact form on the website to let us know what stories and issues you would like us to explore as we move forward with our coronavirus news coverage on television, radio, and digital stories on the web. Now, this live program is being translated in Spanish on La Mejor Radio 104.1 FM, so tune in to La Mejor Radio for instant Spanish translation right now. Coming up in this next story, an organization of North Bay healthcare workers called Health Professionals for Equality and Community Empowerment, or HPEACE, is calling on local hospitals and clinics to better protect their employees. The organization represents over 200 healthcare workers in the North Bay. Co-host Adia White spoke with Dr. Jennifer Fish, who is co-founder of the organization, about what HPEACE members are reporting from the front lines.
So can you describe what you consider to be adequate protection and what you're seeing out in the field that you find concerning?
Yeah, so I think when we talk about what adequate protection is, we really have to look at what the CDC guidelines are. And it's super interesting. I've talked to health professionals in different organizations, and they can totally say that they're following the CDC guidelines, but be doing totally different things, right? And part of that is because the CDC guidelines are considered inadequate by a lot of healthcare workers across the country. And they leave a lot open to interpretation. And so different healthcare organizations can basically choose the policies that they want. On the press conference that we had done recently, I showed a slide actually from the CDC website that details out basically kind of two paths. One of them is like the safest preferred way of providing PPE protections, and that's for all COVID positive patients or patients under investigation, and that is with N95 or higher level respirators, right? And that's for all care and contact with those patients. The other path is what's acceptable, right? It's the best alternative that is acceptable, and that is basically kind of this path that you're allowed to do in the time of scarcity, meaning that if you're worried that your PPE supplies are going to run out, right, then you can start using basic face masks instead of N95s for care of patients. Our concern is that here in Northern California, we're not in a time of scarcity. Our numbers have been fairly low. We've had 2 months to procure all of the supplies. The county itself has procured tons of PPE supplies, but they're still not being used appropriately in that safest PPE level path that the CDC details out. Cal OSHA also has very similar guidelines, which basically say that the best, safest, appropriate way to take care of a COVID positive patient or patient under investigation is to use an N95 respirator or higher. And that face masks are only acceptable when there's resource scarcity.
So just to clarify, it sounds like what you're saying is that, not only are all healthcare workers not getting N95 masks if they work on a COVID floor in a hospital with COVID patients, but that there are healthcare workers working directly with patients who are COVID positive or suspected to have COVID that are not getting N95 masks?
That's true. Yeah. And it's not just nurses and staff. So one of the things that's happening at Kaiser, for example, is they're not providing N95s, but then they say, well, you can bring in your own, right? And so it leaves it up to the workers to procure these supplies. And so then you see where a lot of the inequity happens. So like doctors and nurses might be able to procure their own N95s, but what about the janitors that are cleaning the rooms where you have a high risk of aerosolization of the virus during cleaning, right? Or people so if you don't have a COVID floor and if you're not protecting all of the workers that come in and out of there, then you're putting everybody at risk. The other thing that I would add to that is that the other workers, so people that do transport, the techs, for example, surgical techs, X-ray techs, CNAs, all of those people, they do come predominantly from communities of color. We already know that the virus takes advantage of that, and communities of color are just disproportionately affected. We see that across the country. We're seeing that in our own community, where our own Latino population is 4.5% higher risk of infection. And so when we're not protecting all workers, then we're directly increasing the risk to those communities.
And is there anything else that you'd like to tell us about why you feel protecting frontline workers, specifically healthcare workers, is important for everyone in the community during this time, and to help give the county an equitable approach to COVID-19?
Yeah, so in my mind, if you have a model, like if your numbers are low, like they are in our County. They're going up, and they're going to go up faster because we're reopening faster. Then as you reopen, as your numbers are going up, you have to have systems in place to be able to ensure that you're protecting both essential workers and essential frontline workers, right? That's kind of the 4 stages of Gavin Newsom's like resilience roadmap, right? You have stage 1 and stage 2. Stage 1 is protection of essential workers, right? And we can tell that that's not happening. And I think we can tell that for a couple of reasons. So number 1, healthcare workers are getting infected, right? So Dr. Mace reported on the town hall on 5/20 with Mike McGuire that initially the rates of healthcare infection were 25 to 30, mainly related to travel, but currently it's about 15 to 20%, which is actually still pretty high considering that we're probably less than 7% of the population. And again, if you're not protecting your frontline health workers, then we become vectors. So we risk getting sick ourselves. We risk not being able to be part of the workforce because we're on quarantine or isolation, right? And then we risk infecting our communities, especially when you have workers that go into kind of more marginalized, disadvantaged communities that they're part of. And then that just exacerbates the disparities and the infections that we have. I think it's also important to point out that while HPS has been talking about PPE a lot with the last health conference and with a close to home article that we tried to publish, we actually have other concerns about the public health systems that we feel are not adequately in place, and that includes testing, right? So right now we're like patting ourselves on the back because we're increasing testing, but number of tests doesn't actually mean testing capacity to us. It means the time, or turnaround time from when somebody tries to get testing to when they get the results. And testing can be fast in some systems, up to like 16 hours. For other systems, it's like 1 to 2 weeks, right? That you have to be on isolation while you're waiting for those. The other piece to that is isolation support, which is absolutely inadequate at this point and in this time. So we can do trace contacting, but that doesn't mean we're actually providing isolation support. So I bring that up because those are the 4 main issues that we have and the concerns we have about reopening are related to PPE, which is what we've been talking about, but also testing, what testing capacity means, adequate isolation support, and health equity, right? So we're also, many of us that are part of HPS actually help take care of our most marginalized patients in the community health centers. We're already seeing the numbers of our patients, the cases in our patients go up because of those health inequities. The county has formed a Latinx task force that's only met 1 time. So you can check a box and say that you're meeting the needs of vulnerable populations without actually creating the systems to actually help those people, right, and those communities.
So you mentioned isolation support. How do you feel about the county's site at Sonoma State University? Do you feel like that is not sufficient?
I think it's insufficient based on the knowledge that I have, and I admit that I might have incomplete knowledge of what the situation is, but my understanding is that you can't be admitted into the alternative care site if you have severe mental health issues or drug and alcohol, substance use issues. If you have children, so if you think about our single parents, right, that get sick, what's going to happen to them? They actually will not go into isolation and choose not to get tested because they don't have anywhere or anybody to take care of their kids. Also thinking about like our immigrant community and fears about working with the county and whether they would like leave their family members to go be isolated somewhere where there's not a lot of trust, and they're worried about ICE and worried about a whole lot of things. And so there's multiple issues, and the alternative care site does not serve everyone. It's a great idea, but again, if we don't have isolation support, if we're not actually actively calling patients when they're waiting for their test or when they test positive, beyond contact tracing, to be like, hey, how are you getting your food? What do you need? Do you need someone to pick you up groceries? Like, how is your family getting by? Are people in your home still quarantining as they're supposed to? What can we do to help you do that? And so there's a program called IsoCare that was created by a physician colleague that's trying to fill in that stopgap measure. They're all by volunteers. We're trying to expand that program. The county has not necessarily been open to collaborating with them. There's just a big piece that's missing.
I think a lot of people who aren't directly working with the public right now have trouble imagining what this is like. Can you kind of put us in your shoes and describe what your day-to-day is like, especially, when observing COVID positive patients coming in?
So I think the experience changes day to day, right? If we don't feel that we're adequately protected by our institutions, the level of distress and angst and fear and sleeplessness and depression and being disheartened and angry goes way up, right? I can go into my institutions and feel totally safe, well, fairly safe taking care of patients. There's still fear of the unknown. There's still fear of the fact that my husband and I both work on the front lines. And so what if both of us die? What happens to our family? What happens to our friends? So there is definitely a level of fear. But again, I'm able to move past that because my organization helps take care of me, to the best of their ability and in a way, and helps me feel valued and safe. When people bring concerns and they're silenced and intimidated and threatened, which is what's happening across institutions to people that question PPE, that is incredibly disheartening. And then you sit around and you have social media and you have, the health institutions putting up posters about how health workers are heroes. It feels really disingenuous. It feels really like a punch in the gut, really. Because it doesn't feel real. It doesn't feel like our safety is being protected, and it doesn't feel like our community safety is truly being protected.
And as things reopen and people are going out this weekend and dining outside and enjoying our county parks, it might feel like we're kind of out of the hot zone and that things are safer now. Do you have any messages for people who might feel safe at this time now that things are beginning to reopen?
Yeah, I would say that continuously remaining vigilant and being careful and not relaxing your caution is the most important thing. So continuing to do hand hygiene, don't get together with people, right? Practice social distancing, wear masks. There's a huge question about whether masks are important, and I will absolutely 100% say that everybody should be wearing masks. And just be cognizant that in doing so, you're protecting not only yourself and your family, but your community as a whole. So this isn't about putting restrictions on people and taking away civil liberties. This is really about coming together as a community and really, really trying to take care of each other. The other piece that I would say is that COVID doesn't actually care where you come from and what you do for work and what social circles you go into and whether you're white or black or brown. It will affect everybody. Now, the reason that there's disproportionate numbers in our vulnerable communities are based on the health inequities and the social disparities that are already in place in our society. So that just uncovers it even more. But if we don't take care of our most vulnerable, it's just going to continue spreading at a high level and it will affect everybody, right? Nobody is actually safe in this time. We have to remain vigilant and remain careful. And so wear masks, wash your hands, maintain social distancing. And think of your community, really.
We reached out to Kaiser Permanente about the organization's policies relating to staff safety and personal protective equipment. The statement that they sent us reads in part, quote, "To suggest we are not providing appropriate protective equipment, including N95 masks, is inaccurate. We provide our staff with the protective equipment that is aligned with the latest science and guidance from public health authorities and is appropriate for the level of care being provided. These are the supplies and equipment that are also being used by hospital systems in California and across the nation. We cannot assure the integrity of protective equipment not provided by Kaiser Permanente, and we do not ask staff to provide their own PPE." End quote. You can read Kaiser's full statement at norcalpublicmedia.org. Next up, we talk with Sonoma County Health Officer, Dr. Sundari Mays, who joins us live in the studio to answer your questions every week. Dr. Mays, thank you so much for joining us again.
Yeah, thank you for having me.
So let's start our conversation with a general update about the number of cases here in Sonoma County.
Yeah, I'm going to just quickly give the worldwide numbers. There's about 5.5 million cases now worldwide, about 350,000 deaths. In the U.S., we have about 1.66 million of those cases, and we have about 100,000 deaths. California has close to 100,000 cases and about 3,750 deaths. Here in Sonoma, we're up to 515 cases. And of those, the active ones are 289, recovered 222. And I think the key thing to note is that we have been adding a lot of cases in the last week, and we can discuss that more. I also want to note that as far as Bay Area counties, Alameda has taken a lead. They have 2,874 cases, followed then by Santa Clara and San Francisco with 2,500 and 2,400 cases. Here, north of those counties, we have surpassed Solano and Marin with our 515 cases. The other thing to note is the cases in the Latinx, or the percentage is increasing. Now we have 69% in Latinx and 25% in those people who self-describe as white, non-Hispanic.
So we'll certainly follow up about that in a bit. But you mentioned that we've had an increase in cases. Can you talk more about what you attribute that to at this point in time?
Yeah, so we're doing intensive contact investigation, and we've added 203 cases in the last 14 days. So that means we've added double the rate that we were at 2 weeks ago. So we've had about 40 cases per 100,000 population over the last 14 days. And part of it is definitely because we're doing a lot more intensive contact tracing in large groups, large family groups, and now we found that some of these cases are occurring in work settings as well. So we have farm workers, or we have people who are working in vineyards, people who are working in recycling places, or specific other essential working groups. And so that's part of what I attribute it to. But we're also seeing more community transmission cases, people who pop up, and we're trying to do the best to investigate where they could have been exposed. Sometimes it's really hard, though, because they can't really pinpoint where they've been specifically in the last 14 days. But the trend is towards generally more cases and more cases in community.
And what are your plans to mitigate that?
To continue the testing. I think testing is picking up people quickly, and we're doing a really good job at the contact tracing. What we need to do is to have people, once they're diagnosed, offer them the alternate care site. Because what we're seeing is people who stay in their households are actually infecting all of their family members and maybe even second families that they're associated with. So if we can get those people to move to the alternate care site and isolate themselves away from large family groups, that might stem some of the transmission. And of course, in the work sites, we're trying to get people who are cases diagnosed and get them out of the work as soon as possible.
And I want to talk more about the alternative care site. Can you tell us, are there any restrictions about who can go? For example, if you have medical conditions or mental health conditions?
Yeah, so the alternate care site can take care of people that are somewhat ill. In fact, they can even do oxygen by nasal cannula. They can do IV fluids. But if you have a very ill person with COVID, that person needs to be in the acute care hospital. Also, if there's people who have significant mental health issues, they're also not appropriate for putting in the alternate care site.
So where do you recommend people go if they have mental health issues?
Probably it's going to be more the inpatient facilities at this time, where they can get the appropriate care that they need.
All right. So we had some big news today with Governor Gavin Newsom announcing that there will be some additional restrictions lifted, specifically around barbershops, also about religious services, as well as in-person shopping. Can you talk more about what that means for Sonoma County? Are we there yet?
Yeah, so we are closely looking at the data, and given that we've seen the increases that we've seen in the last couple of weeks, and also because we just opened outdoor dining in restaurants last Friday, and also outdoor seating with food in wineries, as well as the drive-through religious and other ceremonies. I think, and of course we've been doing the curbside pickup and delivery for retail stores now for more than 2 weeks. I don't think we've seen the full impact of what we just altered with our recent shelter-in-place order with the amendments, and so I think we're going to wait a little bit to see where we're going in order to protect the community. The governor's order is meant to apply to counties of all different sizes and all different case numbers and rates and other testing capability, et cetera. So it's meant for counties to be able to look at their own situation and then make decisions as to how to move forward with a framework that the governor has given for all counties, from Los Angeles all the way down to very rural small counties.
And I know there's a lot of people who do own those businesses, for example, barbershop owners, who are really excited about the state's announcement. Do you have any messages for them about what kind of data you're looking towards for when you might allow that?
Yeah, so I would say that we're closely monitoring the data on a daily basis, looking at the number of cases we're adding and where they're happening, how many we're able to isolate, looking at other factors like what percentage are due to community transmission. Our testing capability is really good and has been since the OptumServe sites were ramped up last week, and we're looking at the test positive rate, especially amongst contacts and high-risk individuals. We're looking at the other things like how many cases we're having amongst vulnerable populations, like the homeless or people who are in skilled nursing or residential care facilities. We're looking at PPE availability in hospital settings, the other things like the ICU bed availability, hospital bed availability. So it's kind of like a bunch of factors we're looking at.
And in terms of testing capacity, can you talk more about how long it takes to get back a positive or negative result? And is that included when you're looking at testing capacity?
Yeah, so the positive results come back quite quickly because they're meant to be immediately reported so we can get people informed that they're positive and get them isolated in the right place so they don't infect more people. The negatives can take a little longer. It can be 72 hours. At times we've even had 1 week turnaround when we've had some issues with getting test results back from different labs other than our own lab. So what I would say is no news is good news, but we'll definitely get the negative results back as well.
And is that true for the state labs as well as the county labs? Do you know?
Well, the county lab's turnaround time is really fast. It's 24 hours usually, at very worst 48 hours. So all of the priority tests are being sent to our county public health lab.
All right, so that's good to know. So I also want to talk a little bit more about surveillance in vulnerable communities. Can you tell us what you found in nursing homes? Is there any updates since we talked last about skilled nursing facilities?
Yeah, we've done a lot more surveillance even now amongst all those vulnerable populations. That would be the skilled nursing facilities, the homeless, the jails, amongst hospice. We have done probably upwards of 1,000 tests now in surveillance, but through contact tracing, we have found a few cases in residential care facilities. We had 2 employees as well as 2 residents who were positive in one setting and have isolated people and done contact investigation widely around for everybody in that situation.
And when did you find that case? And how did you find that case?
Yeah, that was through a contact tracing efforts from the county, and it was over the weekend.
And you said all the same facility?
Yes.
All right. And what about within the healthcare worker community? What have you learned from your testing?
Yeah, we found about, I would say, somewhere around 20% of our cases. It might be decreasing now because we're having so many cases occurring in other workers, but somewhere probably around 15 to 20% of our cases occurred ever in healthcare workers, and that's really slowed down in the last month. Initially, early on, we saw a lot more cases in healthcare workers, and it looked like it was mainly due to travel, to conferences, or for personal reasons.
Did that surprise you at all, that number?
It seemed high, but again, I think it was because these people were moving around, going to different states for conferences, going to different settings for work, for example. So it didn't look like it was transmission happening in our own healthcare facilities.
All right, and what about within the homeless community? You're also doing surveillance testing there.
We haven't found any cases in our own homeless shelters. We are testing in the homeless encampments as well, but we have had a few cases of homeless individuals that have come to our county from other counties.
Can you tell us more about that? So which counties where did they come from?
Yeah, I can't really identify where they're from because I don't actually know, but they're from outside our county. They weren't part of our homeless population that pretty much resides here. And that's good because we didn't see transmission at all in the homeless here.
And those people are being isolated?
They've probably completed their isolation by this time.
All right, so I want to talk a little bit more about reopening and Governor Newsom's guidelines. At what point would you begin to put back in state the restrictions we've already seen? What data are you looking at there?
Well, again, we're looking at the increase in case numbers over time, the case rates, the case fatality ratio, the numbers of cases occurring in our vulnerable populations, our testing capacity, the PPE availability, which I hear actually there is some shortage of PPE in different healthcare settings again, so we're trying to get the PPE to them. And our testing ability, our ability to isolate cases, do contact tracing, all those things factor in to when we feel we may need to get more restrictive or when we feel we can open further.
And is there any one of those criteria that's been a red flag so far that we're getting kind of close to meeting?
Well, I think it's mainly the case numbers over the last 14 days. Because we've had so many cases, our rate is, I think, 4 per 10,000 or 40 per 100,000 population now. So that's the one that we are looking at as a red flag right now.
Well, especially since we had a really busy holiday weekend with people crowding Russian River beaches and all that. What do you expect to see from this holiday weekend, and when can we expect to see the results of that?
So if there was transmission from person to person for the holiday weekend, we should be seeing that in the next couple of weeks. That's why I think waiting a few weeks before we make any big drastic changes would be really advisable.
All right. So we have a number of your questions here. I think you already answered this question, but I'll see if you have anything else to add. What is the official date that salons and barbershops in Sonoma County can reopen? We are approved. So can you talk a little bit about what that when someone says we are approved, what do you think their understanding of that is?
Yeah, I think the understanding is the state has moved forward with guidance for opening safely of barbershops and hair salons. But the governor and the state medical officer's intent is to allow counties, even those that have variances, which are able to move forward on the hair salon and barbershops, to make their own decision based on what's happening on the ground in their counties.
And why open more businesses when we've not reached peak? Is this driven by economics and the need for people to work?
Yeah, I think we are balancing that because as we see, there is a lot of harm done to the economics and for people and losing their daily income and work, and that's something that we're really factoring in as well.
Any word on when Airbnbs and vacation rentals might be able to open?
Yeah, I don't think that's part of the phase that we're in, or stage or phase that we're in right now of the governor's plan.
So we'll certainly have to wait a while to see any news about that.
We'll have to wait.
Yeah, that will be a long time. And then why are box stores like Target and Costco allowed to open when small retail businesses are closed?
Yeah, those stores early on were found to be having essential items that people need. And so even early on, they were identified as being the stores that could stay open because people need food, toilet paper, things like that.
Right. And then can you clarify if youth sports are included in the opening of summer day camps?
I think any camp is fine as long as the guidance is met of keeping to less than 12 kids per group with the same instructors over time. So it could certainly be a sports camp of some sort.
All right. And then so the next set of viewer questions relates to testing. So a friend had a coworker test positive for COVID-19, but my friend was not contacted by the county. So can you explain the protocol for contact tracing and how many days contact tracing would go back?
So we would go back to 48 hours before the case had symptoms, because that's the CDC guidance. And we would identify everybody that person came in contact with since that time, all the way through their infectious period as contacts.
So this person likely that would have been not within the time frame?
Probably, yeah, if they weren't identified.
Right. And so can you talk about the county's capacity for contact tracing? Because I know you're also working to hire more contact tracers.
Right, so we're really ramping up. And in fact, we are hiring, especially bilingual people to come and train and be contact tracers. I think the flyer for the job, the positions, is up on our website. So please go check that out. We're looking for people who can commit at least 4 hours a day and do the full state training that's available. That's a 20-hour training, and join our team.
All right. And then how often do you recommend that members of the public get tested if we do not have symptoms? And does the recommendation change based on our job?
I think people need baseline testing. And then if they become symptomatic or if they've had an exposure to somebody with COVID, of course we would be identifying them probably, then they should get retested.
So if you've already been tested earlier in the year and you haven't had any contact, there's no need to go and do it again?
Yeah, I wouldn't purposes? Unless you really have symptoms that are consistent with COVID-like symptoms that we've been talking about.
Okay. So general safety questions. I have a walking buddy from pre-COVID times who lives in Marin County, and I live in Petaluma. Is he allowed to come visit my area so we can walk in a local park with masks and 6 feet away, of course?
Well, I think at this time we're still trying to really limit county to county movement, and it's not really part of the stage or phase we're in right now, but I would say people really need to use their judgment in these things.
Is it safe for kids to swim in a pool? And how? Distancing?
Right, so we're not going to pools yet, and I don't even think that the governor's, I'm sure the governor's plan doesn't include pools at this time yet. It would be hard to wear facial coverings and do physical distancing in pools.
Right, I imagine they're referring to a friend's house, but still that would be the same if they're not within your group.
It would be the same.
Yeah. Well, we only have, I think, about a minute left here. Is there any other thing that you would like to add?
Yeah, I would just like to encourage everybody still to be vigilant and careful and follow the guidance. You know, wear the facial coverings when you're out and concerned about physical distancing with people that you don't know. Make sure that you follow the general hygiene measures. Make sure that you don't go out unless you really need to, and you can go out and enjoy the parks, but please follow all the guidance. And if you see a lot of overcrowding, it's probably better not to be there.
All right, well, thank you so much again for joining us, Dr. Mace, and we look forward to speaking with you more as we move forward with this.
Great, thank you very much.
All right, next up, Darren Lachelle will tell you how you can submit questions for next week's town hall. Darren?
Thank you, Adia, and thank you, Dr. Mace. Now, please share your questions with us so that we can get answers for you during these live town hall programs. Visit the easy-to-use contact form on our website at norcalpublicmedia.org/coronavirus. Fill in your questions, share your name and email, and select the subject of your question. The contact form is displayed on every page of the website dealing with the coronavirus outbreak in the Bay Area. On the page, you'll also find the frequently asked questions section where the answers to many of your questions may already have been shared. This program is being translated in Spanish live right now on La Mejor Radio 104.1 FM. We thank La Mejor for their partnership on these town hall programs and for the services that they provide to our community. The COVID-19 pandemic and shelter-in-place orders have made it necessary for many tech workers in the Bay Area to work from home. In Silicon Valley, where congested freeways, a high cost of living, and limited housing have become the norm, companies like Facebook, Google, and Cisco are now signaling a move to make remote work the default for many employees. South Bay reporter Pamela Lawrence explores what this may mean for the future of work in Silicon Valley.
Last week, Facebook CEO Mark Zuckerberg live-streamed his company-wide meeting to the public. He announced his plan to open remote hiring and begin the shift to a remote workforce of around 50% in the next 5 to 10 years. Here he is explaining that decision.
Now, I think it's clear that COVID has changed a lot about our lives, and that certainly includes the way that most of us work. At this point, the vast majority of us here at Facebook, about 95% of the company or more are working remotely at this point. As we're looking at opening up offices, we think we're going to get initially to about only 25% density and capacity. So a lot of us are going to have to be working remotely for some time to come. And coming out of this period, I expect that remote work is going to be a growing trend as well.
To find out if these predictions could be accurate, I spoke with Mehul Patel, CEO of Hired, a recruitment platform geared towards the tech industry. His company surveyed over 2,200 tech workers and 300 companies to understand how a shift to remote work will shape the future of tech. The U.S. economy lost about 20.5 million jobs in April, and the unemployment rate is at 14.7%. Obviously, the leisure and hospitality industries have been hit pretty hard. I'm wondering if you've also seen this reflected in the number of tech job listings on Hired.
You know what, Pamela, we haven't so far. It's actually been statistically insignificant. We've been looking, obviously, we're curious as are many of our candidates and companies, but it's been statistically insignificant. What we think is happening is bigger companies are starting to hire more, and they're starting to think they can win the war for talent, and we're seeing them lean more heavily into the job market.
Have you seen a shift in the number of remote versus location-based tech jobs since the start of the COVID-19 pandemic?
We have. So that's been the big change. So we've seen, typically, maybe 6 to 8% of our jobs were remote. That's changed to almost 15%, so close to doubling That's been a significant change as companies are starting to think about having a remote workforce.
Interesting. So, as early as 5 years ago, Facebook and a few other Silicon Valley based companies were offering stipends to employees who owned or rented housing near the work campuses. Now we're seeing some companies transition to fully remote or even hybrid workforces. Could you have foreseen this shift 5 years ago? And, was this always in the cards?
Yeah, it's a great question. So I think it was always in the cards. We knew that the best talent, the candidates, wanted to work remotely and on their own terms. And, it was difficult to build a life in the Bay Area or in New York and expensive places like that. So it always felt like this would go to a remote workforce. And, we'd sort of inched that way over the last 5 years. COVID, for good or for bad, has been an accelerant in all of that. I think companies have seen that actually that when they've been forced to go remote, fully remote, they've actually seen productivity stay the same or even improve. And so now they're starting to think about, is this the way we want to work going forward?
Do you think that we'll see any kind of leveling off of salaries or any changes in salary structure if companies are no longer offering, on-site perks or commercial real estate issues, things like that? Do you think it's going to affect salary structure?
Yeah, that's a great question. That's a big question right now. And I think companies are working it out. We've seen Facebook come out in the last week and say they expect 50% of their team to be remote in the next decade. But they're also going to adjust salaries to be consistent with the cost of living where you're at. And so, I think there is going to be a change in salary. I think you're going to see, lower cost structure, as you said, around real estate. But I also think companies are going to really think hard about should they be paying someone the same if they're in the Bay Area versus in, the Midwest.
Sure. So now as more candidates come to expect remote work to be their future, let's, take out our crystal ball. Can you make any predictions about how that might affect tech hubs like Silicon Valley?
Yeah, look, I think we've started seeing in the last decade a little bit of a flattening. There's no question that places like Silicon Valley are still the place to be. But we started seeing kind of markets like Austin and Seattle and Portland and Toronto also start becoming viable hubs. And to become a viable ecosystem, you need a couple of things. You need capital. And capital now, venture capitalists invest all over the world. They're not tied to just up and down the Bay Area or just, around New York or London. The second is you need the talent, and that's always been the issue. And now with COVID and people wanting to work remotely and build lives and families in places that maybe are more better places to raise families from a cost or a quality of life perspective, you're going to see that talent be all over. And so I do think if you look at those couple of things, you're going to see these ecosystems start flourishing. Does that mean Silicon Valley diminishes? I don't think so. I think this is still the major place for tech innovation, but I think you're going to see other ecosystems. You're going to see companies, their workforces in different places.
You collected a lot of data. So I'm wondering if there's any other insight you might want to share about the future of work in the tech industry.
Yeah, I think the big theme, Pamela, is going to be this move to remote work. Well, we're seeing that 80% of candidates say they'd be happy taking a job at a company where they've never actually been to the office, and all the interviewing is done remotely over video Zoom. And we're seeing companies very quickly, that stat I just gave you, where there's almost a doubling on our marketplace hired for jobs that are now remote. And so I think those two are coming together quickly. So for us, what was surprising was just the pace of adaptation in a remote world and how companies have really moved into this new gear, talking about a new normal once we're back to work, and that new normal will be much more remote. And as you said, that has ramifications for compensation. It has ramifications for what are the tech ecosystems. And so I think you're going to see sort of a pretty fundamental change in work because of COVID.
Jenny Lynn Holmes of Catholic Charities spoke with News Director Steve Mencher last week about everything her organization is doing to alleviate the current crisis. As some in our community see the pressure easing, Holmes knows that her job is just starting.
Jenny Lynn Holmes, thanks so much for joining me.
Thanks for having me.
All right. Now, you're the Chief Program Officer with Catholic Charities, and as such, you were telling me the other day that you had 4 main areas that you oversee and that Catholic Charities is so deeply involved in. Can you briefly tell me about that, and then we're going to dive into them and see how they've been affected by the coronavirus pandemic?
Yeah, absolutely. So Catholic Charities, the Diocese of Santa Rosa, we provide services in multiple counties and kind of in 4 core areas of work. The first area is in the work with the undocumented population or immigration services, helping people find legal pathways to citizenship. And we also provide services for seniors in our senior care memory center, as well as other opportunities that we provide through a program called I'm Home Alone, calling homebound seniors who are in need of, connection and safety services and just checking in to make sure that they're doing okay. The third area we do a lot of work is in the area of food access and support. So helping people with food deliveries. We do food distributions in multiple communities and making sure that people who are food insecure are getting the access to food that they need. And then one of our biggest areas of service is our areas of homelessness and housing solutions. So we provide care through a variety of different things, but we're the largest homeless service provider between the Golden Gate Bridge and the Oregon border, working through our emergency shelter programs, our housing programs, our street outreach services, and a variety of different things to help people on the pathway towards housing.
Okay, now all of these things have been so deeply affected by the coronavirus. And I know in just a moment I want to ask you some very particular and specific questions about immigration and our undocumented communities. But first, in the last week or two, Catholic Charities has been involved with the city of Santa Rosa and the county in setting up a new homeless shelter at the Finley Center parking lot. So can you tell me in some detail about how that's going, what you've set up, and how it's helping during the coronavirus?
Yeah, absolutely. This is definitely a new and innovative program, but we're in unprecedented times, and that calls for new and unprecedented action in many ways. And so the city and the Santa Rosa and the county of Sonoma have been working in a variety of different avenues to try to keep people who are experiencing homelessness from risk of exposure. There was a recent report that came out from the University of Boston that people who are experiencing homelessness are 3 to 4 times more likely to have severe complications if they were to contract COVID-19 as opposed to somebody who's housed. And if you think about it, right, all the things that we're being told to do, isolate in your home, wash your hands frequently, have good hygiene, all of those things are virtually impossible for someone who's living unsheltered in our community. They don't have access to restrooms or hand washing stations, and they can't self-isolate in a home. And so there's been a variety and a steps that we've taken. The first was kind of to secure our current operations, make sure that we've got new protocols in place around cleanliness, around social distancing within shelters, all of those things. And that even required actually moving individuals out of our shelters and into a variety of hotels so we can make the right level of social distancing between bunks. The next was where the county of Sonoma kind of created what's being called non-congregate shelter. And that's where we're working at a site called Sonoma State University, where we take people who are in the high-risk category experiencing homelessness and place them into this non-congregate shelter to avoid the risk of exposure. And the most recent is with the city of Santa Rosa, and this is an effort to really address the growing encampments in our community and how we can particularly help people who are unsheltered. We have some pretty dense encampments in specifically downtown Santa Rosa, and so the city of Santa Rosa, in partnership with us as their operator, set up what's being called a safe social distancing site. It's at the Finley Community Center, and we have 68 tents that have been set up that are properly socially distanced, so 12 feet apart, which is the CDC guidelines. And individuals are being targeted in these most densely populated camps to provide voluntary relocation to this site. And at this site, we have restrooms, hand washing stations, shower trailer, We have a laundry service, 3 meals a day, and on-site staff and security to make sure that everyone in the site is safe, as well as the surrounding community. We're about a week into operations, so it's been a long week of learning. So,
how many people are there now at that site?
we're about half full right now, so we've had about 39 people at this point. A lot of the work has been slowly engaging individuals and getting them ready to make the move. You know, they're packing up their stuff. I mean, much like many of us moving from a home to a home, you know, it's moving from one site where all of their belongings are to another site. So a lot of it has been working through those logistics with the individuals. So we're about halfway full at this point. So.
Okay. Now, I had a couple of questions that had come in, but here's one about rent. Unfortunately, I'm unable to work because of coronavirus and cannot pay the rent. And this is connected to that. Because of the coronavirus, I'm without work. I need financial help like everyone that was affected.
So this is something that we saw early on in this crisis, that this was going to be probably one of the biggest needs, you know, quickly. And some of this is lessons learned from our, unfortunately, having to deal with the Tubbs fire and other disasters in our communities. But we see that food is kind of the first thing that individuals need. So we've ramped up our food services. There's been over a 76% increase in the need that we've seen in just our regular food distributions. But we also knew very quickly, the way this was evolving, that there was going to be a huge need for rental assistance. And our number one job as a homeless service provider is to keep people out of homelessness. And everything that was starting to unravel are huge future indicators of homelessness. And so we've put in place a rental assistance program that people can access, whether you're undocumented or not. And individuals can reach out to us and get the services get screened to be able to get our rental assistance programs and make sure that we keep them in their homes, especially those that aren't working or have other economic factors that are affecting them because of the coronavirus outbreak. So they can call our front desk, and I can get you that information to put on the screen. So when individuals would like to reach out, we'd be happy to get them ready for our rental assistance program.
Well, that rental assistance program really does sound like it's going to be a lifesaver for many. Now, as you and I were talking the other day, it occurred to me that many people might have the idea that this was a time when things were winding down. We have some fewer cases, perhaps fewer hospitalizations, businesses are opening up. And yet, when I discussed this with you, you had quite the opposite feeling, that you were expecting an avalanche of need in our community, and this was what Catholic Charities does. This is what you do, but you will need an incredible increase of resources in order for you to be able to meet those needs in our community. So tell me about how you're viewing the next, say, 6 months to a year, about what our community is going to be needing.
Yeah, unfortunately, this is just the beginning of the crisis. You know, even if as the numbers drop and we start seeing some restrictions limited, the economic factors that are an outlier of all of this, that are going to affect our most vulnerable individuals in our communities, is going to have ripple effects for years at this point. We're looking at a major recovery when we look at things from a social science and a human impact. People will not be recovering from this, even if they don't get sick. They won't be recovering from the loss of job, the loss of housing, the variety of things that are going to come from all of this. You know, we're going to be, our governments are going to be facing major budget shortfalls. And philanthropy is going to look a little bit different too. And so it's really going to take a toll from so many different directions. And so, you know, as nonprofits, we are very much second responders. We come in as we see these initial crises impact the lives of human beings, and particularly our most vulnerable, the people that are often forgotten or left in the shadows. And we can only do it as we have the resources to meet the need. And that really takes all of us as a community to come together and make sure that we don't see an increase in homelessness. We look at the vulnerable families. We look at people who have fallen on extremely hard times out of things that are totally outside of their control. And we make sure that we take care of them, because the long-lasting impacts are going to be felt for 6 months for sure, but definitely for the next couple of years.
Let's talk finally about food and food distribution. We have not seen in our community these kinds of lines of people for miles and miles lining up in front of food banks. It leads us to believe perhaps that the nonprofits in our region and specifically in our community are kind of keeping up with the need for right now. But it seems like, again, within the next 6 months to a year to more, that people will start to be going hungry if we don't get food where it's needed. So tell me how you and the other nonprofits who work in the food distribution area are thinking about how to keep our community fed.
Yeah, absolutely. Food is the one of, especially in the first few weeks of this crisis, food was the number one most requested thing. It's now evolved into rental assistance and assistance for people experiencing homelessness. But food is going to be an ongoing crisis. That, as you see the economic, you go into depressions or recessions, wherever we end up, you always see the food need increase as the economy decreases. And so we absolutely are experiencing a huge increase. We've had to add food distributions at a couple of different sites, including a drive-through distribution. We're having to space people differently, so just even the mechanics of how we provide the food is very different. We've had a great partnership with Redwood Empire Food Bank. Yeah, and they've been kind of like a centralized hub to bring food in and be a kind of a local donation, and then they get the food to us as a local service provider for us to get to the people. And so that's been a great way to work together. Also in the senior services programs that Catholic Charities operates, we've gotten a little bit of funding that has allowed us to do some food delivery to our homebound seniors who are so medically vulnerable and in that kind of high risk category. They can't leave their homes, even to go to the grocery store, because the risk is too high. And so we're actually doing food deliveries to their doorstep to make sure that they are getting the food that they need. As well, because they can't get out and go to the grocery store. It's still too much of a risk for many of them.
Well, we've had a number of questions from people who are undocumented and wanting to hear about aid resources. So we want to remind people that you can call California Human Development. They are responsible in Sonoma County for distributing financial aid to people who are undocumented. Their phone number is 1-707-228-1338. Again, this is the aid promised by Governor Gavin Newsom for undocumented residents who don't qualify for other types of aid, including federal unemployment or the stimulus checks that have been mailed out. So again, that phone number is 1-707-228-1338. Now you have to apply for that aid by calling that phone number. Although we will say there have been a number of issues with getting through to the phone number. We tried that last week. It has been busy. Calls have been reported to be dropped. So we also want to give people a number of other resources that they can apply for in the meantime, although we do encourage you to continue to try to call that phone number and apply for aid through California Human Development. Some other resources that we have here in Sonoma County are Corazon Healdsburg is a nonprofit based in Healdsburg. And they're really aimed at residents of northern Sonoma County, although they are offering resources to Sonoma County residents in general at this time because the need has been so great. So to get through to them, you can dial their phone number 1-707-395-0938. They also have a number of grants that they'll be giving out for people who are in need right now. You can apply for those on their website, corazonhealdsburg.org/COVID-19. Again, their phone number is 707-395-0938. They'll also help you apply for unemployment if you need help with unemployment applications or have any questions about whether or not you can qualify. Again, the number's on your screen, and they are bilingual. So if you have questions in Spanish, they have people there who can help you, walk you through other resources that are available. There's also pandemic EBT. So this is something new through the state of California, and this is additional money on your EBT card for food, and that's $365 per child. Now, if you get Medi-Cal, if you're in foster care, then you already qualify for PEBT. You should have already received that card in the mail. But if not, then you can apply on their website. That's ca.p-ebt.org. And if you qualify for free and reduced price lunch through your school, then you can still apply for that online now. So Darren Lachelle will tell you more about how to ask us questions to our newsroom for next week's Town Hall.
We hope that you will join us next Tuesday night for our next live interactive Town Hall program. That's Tuesday at 7 o'clock. Next week's program is planned to be our last live Town Hall special, so visit norcalpublicmedia.org, and there on our easy-to-use form you can put in your ideas about how we can extend our coverage into the future. We want to hear from you. And we can cover those on TV reports, radio reports, and even online digital stories. So remember to share your questions, concerns on our contact form. Keep tuned in to NorCal Public Media for the latest on coronavirus news. I'm Darren Lachelle, here with Adia White for NorCal Public Media.
You're watching Northern California Public Media, made possible by viewers like you.